Hello, everyone.
Hello. We're going to give it another.
Hello.
Are we in our breakout room? This is a breakout room, right?
This
Yes.
It's
is
a breakout room, and
Okay.
as many people as you can, if you can turn on your cameras. If you can't, we understand, but it really makes it feel more like a conversation when people are in person. So we're glad you're here.
I
What a great group of
apologize.
people.
It's John Catalan. Something's wrong with my video, and plus, you really don't want to see me anyway. So,
If folks could mute themselves if they're not talking, that'd be great.
Hello, Representative Curry.
Beth,
right.
can I just
Hey,
start
how are
with
you?
a question before we dig into the work? I love everything I saw on the screen. Very excited about all those suggestions, but wondering what heavy lift of legislative I guess movements have to happen, because all of the state grants that we have are connected to legislation, specifically around school readiness and daycare. I'm just wondering what has to happen behind the scenes, and if there's some advocacy that I could be doing as a community leader to, at some point, to be moving those needles simultaneously.
Yes, Dr. Ferguson, I appreciate that question. As you're stating that a lot of these, not a lot, some are our own, some are OEC imposed, but some are statutory. These programs were developed and funded at very different points in history with different goals. I think the whole point of the Blue Ribbon Panel is to get unified on the goals and a funding system that makes sense. And the other thing is also aligning with Head Start so that people who are also meeting those requirements, that it doesn't look that different. So I think the Blue Ribbon Panel, the report will definitely be highlighting what statutory, what's regulatory, what's federal. But I appreciate you asking that question. Yes, there are changes. We like what we saw too, but we know there are still miles to go before we sleep. Even if everyone agreed and we did all of that, it's a lift.
So thank you for starting us off with that first reflection and question. And just for everyone on, just make sure everybody's in the right room. This is the funding systems breakout. And I think we would like to start our conversation this afternoon, just understanding people's overall reactions to the funding system recommendations that we shared. We had 5 recommendations. We're interested. I think Taylor's going to bring them back up for us. So the first one was consolidating from 5 different funding sources to 1. The second was looking at funding programs very differently than we fund them right now by classroom. The next was to move to really one contracting vehicle. So to use the state of Connecticut POS contract that we use for child daycare contracts right now. The fourth was the ECE governance bodies, and the 5th was convert the funding structure to true cost of care rather than market rate. So just to start opening the floor to what are your overall reactions to these recommendations? Looks like we have, I can see Joanne's hand is up.
Hi, so I would argue that there's probably more than 5 sources of funding if you include the funding from the PDG grants to the OEC to the local early childhood collaboratives.
Good point. We should add that in.
Yeah.
PDG has been a big part of things.
And of course, I'd like to see that funding continue.
So would we. As Beth said, it's been incredibly helpful to OEC to be able to do a lot of our projects and innovations. Meryl's hand is up.
Yeah, I think all of those are great recommendations. Paying providers quarterly in advance by classroom with one system, as opposed to having, the Head Start stuff, the school readiness stuff, and the CDC stuff with 3 different sets of things to process. All sounds good.
Thanks, Meryl. Kimberly.
Yeah, I was just wondering, I think it's great, the consolidation and the braiding of funding streams. And I wonder if it should also add, and any future funding sources will also be braided and incorporated together, or whatever the wording is, just so that, when this goes before the legislature and they have to make decisions, that we don't make any decisions that stop us from continuing along that path moving forward, because let's hope there'll be more coming from the federal government at some point. So and it might just be about wording, but just making sure that we set it for the future.
Great idea.
Yeah, because there was something in the last legislative session about creating a pool of money for the future, or a way to, Meryl knows what I'm talking about, the
The fund.
The trust or the
childhood-
FSA?
Yeah, the trust.
the trust. Thank you.
Yeah, the early childhood fund, yes. We're already having discussions about that. John Catalan has his hand up for a while.
Oh, I can't, that's great, Maggie, to help us out, because I can't see everybody's hand up.
Yes, so John.
Yes.
Hi, Maggie. Hi, Catherine. Quick question. How will the true cost of care be determined?
John, there's like national models for how to do cost of care that the Administration for Children and Families has been working with states on. So we have started some of this work on the full cost of care. And I think for now, I think John and others who were engaged, you would have seen the narrow cost analysis. That's sort of a first step for us as a state, but that's narrow cost analysis has that name for a reason. But it includes things like, salaries paid at appropriate professional rates for the education and training that the staff have, that kind of thing. So, but that would be a very public process, with lots of feedback.
Thank you as always.
Dr. Ferguson has her hand up too, Cathy. I didn't know. I'll turn it back to you. If I see anyone not getting called on, I'll call on them.
Yeah.
But you're in charge.
Dr. Ferguson.
Yeah, just have thoughts about capacity amongst programs when it comes to, I think, bullet number 3 about the POS system, just aligning what's necessary for state contracts. And when we think about, I'm a state contractor, so I know it's just not that easy. When we think about making it easier on one end, not putting pressure on providers on another end to start jumping through hoops to solidify this type of situation, it could be a bear. When you have low capacity and or stressed capacity, I should say, at this point in the situation. But love everything I see, as I said before, but I think process, and I think strategically, how do you sell this to folks if they're reluctant around the intricacies of the pieces, like the moving pieces? That I think could be a little more fearful than the greater good at the end of the day.
And Dr. Ferguson, can you share a little bit more about what you were saying around the capacity and moving to to POS contracts? Because I don't know that I introduced myself to everybody here, but I am the Director of Grants and Contracts at the Office of Early Childhood. And so this is, we want to hear this feedback and understand, what might be some of the challenges going to that.
Yeah, I could definitely tell you, I have an entire department that does this for me. I don't do this. I have about 12 people because we probably every last one of these grants besides Smart Start is the only one we don't have here at Alliance. So I have about a dozen folks that that manage the reporting, that manage the accounting, that manage all of that. And clearly we're talking about simplifying that, right? So I love that idea, but as it stands, it's not an easy win. And I do believe that there are some requirements around contracts and things of that nature with state government that providers will have to meet. What they are, I don't know. If OEC has the power to determine that, to make that easier, I don't know. I think we're talking about latching onto an existing system here, if I'm correct. So I would beg you to do that research and really think about what those intricacies are. I have an entire department that handles this. So I don't have to know all those details.
Okay, thank you. Thank you. Mary.
Hi, good afternoon. I love everything that's up here. I just would, knowing that regionalization is a charged term here in Connecticut, I would really recommend, using the resources that we already have through the local early childhood councils that already exist and are already working in towns and in some cases across towns. And I think that could really help smooth that path because I just feel like when people see regionalization, they, their hair starts burning or something. So.
Thank you. Thank you. Joanne.
Mary stole a lot of my thunder. I was also going to talk about concerns about how the regional governance bodies would be set up. How many are there going to be, about communities in different regions being treated inconsistently, and the fact that, so I'm from the Early Childhood Collaborative of Southington. We're surrounded by communities of different types, and if we're all in the same region, I'm not sure how that's going to work. Cheshire to our south is very different than Meriden, the next town over, or New Britain.
Yeah, Joanna and Mary, I'm glad you're raising this, and I think we have to pay really careful attention. One of our sort of tenets, which we don't have time to get on the tenets, is to sort of rely on existing systems where we can. For example, in the procurement process, advantage programs that are existing state-funded programs because they've spent years meeting all the requirements, et cetera. And in our governance bodies, certainly our hope is to build on the strengths of existing governance bodies. But when you look at the whole state and the whole state system, most communities don't have a governance body. So you could either have a statewide structure that took care of that or a regional structure that took care of that. And we felt like a regional structure could build on the strengths of the existing local councils in that region, because there'll still be a need for local councils. So I think the big question is infrastructure. We have never had the infrastructure we need to support councils, local councils, and that's why we've looked to philanthropy and preschool development grant funds, et cetera. So I think we've got to make sure in this recommendation that we're clear that there needs to be infrastructure that supports the healthy development of local governance councils. And I think one of the recommendations that this work group made is that the regional councils are given the capacity and funding needed to support local governance and local councils, because it's been a missing piece and it's been patched together. So this feedback's really important for us to keep in mind, that you want to make sure we build on those strengths. So I just had to respond to that, Cathy, sorry.
Yeah, no, thank you. Representative Curry, and then we'll go to Maryland.
Good afternoon, and my apologies for not being on camera. I'm actually in the car at the moment. Yeah, I think all of these recommendations are fantastic, and I think braiding together funding systems and simplifying things is not just kind of a desire or want. It's a must and a necessity if we want to move the system forward. And luckily, that if this does require, as noted earlier, some legislative fixes, this concept is not new to the legislature, as we have been working on K-12 funding to simplify 11 systems into one. And so I think this would be a no-brainer for my colleagues in the legislature, luckily. With respect to the regionalization conversation, you know, oftentimes the very first comment from folks about regionalization is, oh, that's a scary word, rather than just saying, or simply being able to say, let's see what this may look like and work from there. And so rather than leading from a place of fear or misinformation right out of the gate, I think we, as members who are interested parties, need to take a step back and be open to what that may look like, because people will listen to what we say on the outside. So it just kind of a word of caution when it comes to that, because believe me, I would love nothing more than to regionalize almost everything in this state. 169 fiefdoms does not work. And it's not going to continue to work if we aren't able to get out of our own way. So great recommendations. Look forward to the work.
Meryl.
I had a couple questions. One about care for kids. Is the goal to convert the state funding system to cost of care so care for kids doesn't need to be part of that equation? And that if you're in a state-funded school readiness or Head Start program, that's funded at cost of care, and you don't need to add in care for kids on top, and the care for kids would only be used in the private programs that aren't getting a state contract. Is that the idea? Or because we still have this issue where particularly like places with large undocumented communities where they don't apply for care for kids, and therefore the state funded programs in those areas have trouble making ends meet because they don't get the care for kids funds that the other programs do get.
Meryl, it's such a good question, and the funding and cost group was talking about this just today, because when you layered one on top of it, when we were paying 30% of the market rate, that was one thing. But as we want to move toward paying more like 75% of the market rate, then you could be really literally double dipping for a certain number of kids. So I don't think that's been worked out. We'll look to the panel for that, but we are thinking about it, or thinking about some kind of care for kids reimbursement for a certain portion of the day. If we figure out the true cost of care only pays for, say, for example, school day, then you could add wraparound. But all of this, we're really in the conversation phase and really open to feedback from the field about care for kids, because those certificates are super valuable to families working off hours and that kind of thing. So, how do we make the system work for as many families as possible?
Okay. And I guess the next question, looking at how Vermont has just expanded their system, they went with essentially care for kids on steroids, higher income limits, more money going into the system. That's very different than, say, New York's universal pre-K, where it's contracted slots. Is there any sense yet on the direction for, like, how do we grow the system to actually serve all the families that need it? One direction or the other, or a continuing blend of things?
Well, I think we're open to feedback. I don't think we've decided that, but I will say that we've consistently heard from providers that they're destabilized by the per child reimbursement with different amounts of money coming in every month. And that's for, if you're there one day a month, you get paid for the month. So when you look at care for kids, where the dollars change hour to hour sometimes as parents' work schedules change, we don't see that as a system that leads to stabilization as much as, we're really lucky in Connecticut, where we already have a system of state funded serving 16,000, now 17,000 kids. And we're just trying to think about how do we stabilize that and maximize the use of care for kids. But I don't think it's one or the other in Connecticut. But again, we haven't, the panel will be briefed and people will weigh in. And there are a lot of providers on the panel who can provide feedback as well, as parents, because we haven't really been talking about parents here, but one thing that Representative Curry said made me think of families. Like another group really disadvantaged by complexity are families. You've worked with families, all of you on this call, trying to figure out, do I get Head Start? Do I get school readiness? Should I have Smart Start? Should I? I think Valora Washington in our first day said, complexity leads to inequity. And we really believe that, and that's one of our operating tenets here, that the simpler we can make the system, the easier it will be for families to access care.
So we have a few more minutes before we go back to the large group. And I was just, curious if we could just focus in on the second bullet and just get some feedback and thoughts on this recommendation. Some of you have already addressed it or shared some thoughts on it, but for everybody here, funding programs by classroom based on blocks of time. And I shared, there's part-time and full-time, but we would love to hear your thoughts on this recommendation and what are the different blocks of time that we should be thinking of.
Just a little bit more clarity here for the question. Blocks of time meaning traditional care hours and non-traditional hours.
Right. Well, we had already started thinking about like a full day or a part day or an aftercare or a school year, school day. So those are some that are already like in the system, right? Those are some of the different ways that programs can receive funding. But funding by classroom is new. Not that's our approach to saying we're going to fund by classroom. We're not going to fund by attendance. We're going to fund by classroom, and classrooms could be designed. And Beth and I were having this conversation, like kind of using Legos and building a tower. You have some part day, you have some full day, and you make up, the constellation of your classroom based on different types of.
And you could have part week, like you could have one family that wants 3 days a week and another that wants 2 days a week. That makes it more affordable for them as well. Like, so that's what Cathy's talking about, like different sets of time. I know Susan, looks like Susan has her hand up.
Susan does, yeah.
Hi, yeah, that's a great idea. And I think, yes, something along the lines of like a sliding scale for, program hours, so there's something about the number of hours per day, hours, how many weeks per year, that, so you can kind of, there's a little flexibility because not, we can't even align on all the hours and weeks of programs in one area, so that would give us a lot more flexibility.
Thanks, Susan.
Yeah.
Meryl's hand is up, and then Eva.
I think that the current school readiness notion of having a half day, a school day, and a full day, full year makes sense. If you were doing something where you had more school day slots with people using Care for Kids as a wraparound, that is another way to do it. I think doing it by classrooms makes complete sense. You've got to pay a second teacher if you got 11 kids in the classroom. So certainly no arguments on that. One thing that I would ask about would be sort of actually going a step back. When you go to contracts as opposed to grants, the legislature can't see how much money is going into their district easily. With school readiness, priority school districts can flip to the back of the budget and see how much money is going to their district. And that's what made school readiness always very popular with those priority school district legislators. With Care for Kids, they didn't have a clue until we did fact sheets to show them how much was going into each district, because nobody would go look at the Care for Kids reports to figure that out. Just that is, the issue of how you get legislative support for this. And just sort of, I still think that having contracts makes more sense, but I'm just sort of raising that as an issue to make sure that you get it funded.
Good point. Eva has her hand up.
I'm gonna comment on Meryl's comment and then make my own comment.
Okay.
I would I would agree with Meryl on the fear of funding, but I would also point out that if we're going to transform the system, then we have to break out of the same old structure where there's finite money for certain programs and it's going to run out unless the legislature recoups that money or reinstates that money. So in a transformative system where we're no longer dependent on the fiscal year depositing said chunk of money, then we no longer have to worry about the concern that Meryl pointed out. So I would prefer the Blue Ribbon Panel plan to no longer be so dependent on year-to-year fiscal budget year fiscal allotment. Okay, my comment, my concern with the word classroom is when you're working in a system where not everyone is in a traditional classroom setting, or not every educator or director sees themselves as a traditional classroom setting, even though they technically have a classroom, that the vocab that's being used might be misleading as how they're going to fund. So using home childcare providers as the example, not all home-based providers call their program a classroom. And I just want to make sure that when you're using vocab similar to what the Representative Curry said earlier on the word region, there's certain words that might be triggering or fear or have certain connotations when we're talking about funding systems, and we should just be very conscious of that. That's what I had to say.
Thank you. That's a really good point that you bring up around that we should be careful of the words that we're using and how they might have different meaning in different spaces. We have just about 5 minutes left in our breakout. So I just want to give anybody an opportunity who hasn't spoken, who has any suggestions, right? It's not just about what we should be looking at, but some suggestions as to how we should be addressing some of these before we go back to the full session.
Cathy, I want to not miss this comment that Joanne has in the chat, because I think it's something that we really need to take note of. Joanne, do you mind speaking to that? Others respond as well.
So what I said is that I want the panel to remember that childcare is not an island. You know, I'm wearing a local collaborative hat, so it's important to recognize that families and childcare providers need to connect with the school districts, birth to 3, the ECCP program, social service providers, healthcare, etc. An example of that came up in our town when I had my community meeting in June was that we were talking about the increase in behaviors, difficult behaviors in children. And one of the center directors said, I was trying to get information about the children in my care to the kindergarten teachers so they would be prepared for that transition. And the kindergarten teachers didn't want the information. And the superintendent and assistant superintendent were like, what are you talking about? Of course we want that information. And so we're working on a way to get that from the 11 centers and 3 nursery schools to the district. So there's a lot of connections that go up. So I just want the panel to remember that.
Good point.
I'm not sure how you incorporate it, but
Well, I think you're making the point that we really need local councils to coordinate these early childhood services, and the public schools are a part of the system. Yesterday, I had a reporter tell me that a kindergarten teacher said, kids, it's not their problem that parents need coverage. And I disagree with that. I think during COVID, we learned that schools are providing really important coverage for families so they can work. So public schools serve as many preschoolers as do school readiness and CDC combined. And so they're part of the system. And that's why we need the local councils to braid that and figure out what, in some rural communities, it's mostly public schools. In big cities that have large providers, there's just collaboration and there's both. In some places it's all private, but it really depends on the local context. But you can't forget the public schools and all the other public resources like the libraries and, the home visitors and all that. So I think you make a really good point.
Eva, I see your hand is still up. I don't know if you have another question or comment.
I had a quick question. I
Sure.
was wondering if in this funding system layout, there's thought in after school programs, trips to the museums, and parents who don't want traditional care, but do need some funding to support the care that they're giving.
I don't think we have, but we'll add that in.
We had another question in the chat, which would be, great to share with the group. Simone, do you want to share your question that you put in the chat so we can respond?
Good question.
It was more so if I possibly was not understanding it correctly. If, my child is in a center and the funding is by classroom, as the child moves from classroom to classroom, is that then a situation where I may lose my funding because they moved, from the toddler room to the preschool room? Like, I didn't know if it was that granular or if I was reading it incorrectly.
Yeah, Simone, it's a really good question for us to take note of. Like, we just funded 1,100 or 1,300 infant toddler spaces. And you may have a state funded space now if you're in one of those rooms, but if that program doesn't have state funded preschool, then you would lose that kind of funding. You might be eligible for other kind of funding. But I think, so we have to pay attention to that and think through that. It's a really good question. But for the most part, this is just meant like most school readiness providers. Now there's some that don't, some have 4 kids, but most have 3, 4, 5 classrooms that are school readiness classrooms. And so they just get paid for 5 classrooms. And if your child moved between classrooms, it wouldn't make a difference. They're just counting how many kids, and we'd have to work in incentives for having the classroom full and that kind of thing. So it's not as simple as just change the funding. We would need, we want to maximize access for families, and we don't want to incentivize classes of 14. So we're open to your ideas about how we can do that. But I do think we have to pay attention to that and thinking about families and the funding. Does the funding follow the child if we pay by classrooms is a really, really good question. And in most, I don't think it'd be a problem, but we have to remember there are some programs, and to Eva's point, family childcare setups that are different. And so we're gonna, if you move to a pay by classroom model, you're gonna need a few different models that work based on how the localities assign the slots.
So it's the big ideas, but it's also the granular details.
Yeah.
Simone, you were saying, because we do have to think of those as we can have the big idea and the big concept, and then think through all the smaller granular details that we have to work through. Because the goal is to make this easier for families and provide stability to providers, right? And so if the change in the system doesn't achieve that, then we have to be thinking through how that can work with these new recommendations. So we have just about a minute and a half. I don't think I have any more hands up, but just want to give everybody last opportunity to share an idea or a suggestion before we go back to the large group. Well, I'll say, I just want to thank you for your participation. This is one part of how we're going to gather feedback as we move our recommendations through the process. So we thank you for joining us and sharing your feedback in this group.